there, 2264. This is Dr. Amy coming here. Wanted to highlight the ethical content for exam 3. Have a few options here for you for resources to move from that knowledge base to more of an application to both patient scenarios, case studies. We'll kind of take a deeper dive as we go through that. But first I want to introduce you again to the foundations of ethical decision making, let you know some of the thought processes and some of the themes that are going to be threaded throughout ethical dilemmas, and let you kind of look and explore. Every individual will approach every situation with a slightly different perspective, and that's okay. That's a good thing. That's what makes it a rich environment. We all bring different perspectives. However, rudimental to every ethical decision making process, we want to keep the patient at the forefront, and what's in the best interest for the patient is going to be what drives the bus with ethical decision making. The point in the outcome of this information in this module will hopefully be to instill more tools in your tool belt as you approach as a student nurse, as you approach as a novice nurse, new grad, and embark into your nursing career, that you're going to be able to approach situations that are troubling, to say the least, because there can be two right answers, there can be two wrong responses, and we need to make sure we're advocating for the patient, self-determination and autonomy for that patient, what the patient's wishes are, but at the same time, we also are bringing that clinical sound, nursing science, and that art of caring that we're going to mesh with that as we help try to use our critical thinking skills and implement the best plan of action and plan of care to support optimal outcomes for that patient. So let's go ahead and jump in and get started. Again, there is a reading assignment, as I mentioned in 5.4 regarding legal. I have pulled away the required reading and pulled off, trying to make it a little not so heavy and cumbersome with so much information in reading material. However, that does heighten the importance of following through with the PowerPoint and this video guide, looking at the blueprint, as well as I've given a little bit of a study guide available as well. So make sure that you're familiar with each of those concepts, not only that you're familiar and you can readily spit off a definition, but that you can actually apply that. You can recognize that if given a patient scenario. So again, there will be some chapters listed here. Those are not required. If I don't mention it or I don't have it included in the blueprint study guide, it's not going to be as critical. It's not going to be the need to know information, but I have included some nice to know information as we go. As far as reading assignments though, I would like you to utilize a resource by looking up the Code of Ethics. Interestingly enough, this is on the Nursing World in a website, but the interesting aspect of this is they charge for this document. So when we're in class, I can give you that. I'll pull it up on the big screens. We kind of review that and peruse through that document, each one, seeing how that, again, the application process, how that would unfold, how you will recognize that in the clinical setting. You can pull it up if you want to pause here and pull it up so you can reference it as we go. Be my guest to do that. And also, if you want a printed copy, I do have a few in my office that I can give, but generally an electronic version will suffice. But do know that you want to know where to find it. As I've mentioned, and I will allude to this throughout the lecture here, as I highlight the ethical content today, I want you to be aware that you must be aware and cognitive of these aspects of the Code of Ethics, because it is available information to the public and they know what is expected, as well as we will want to maintain this as well, just to stay sharp in our profession. So, class learning outcomes for today, we want to differentiate among the following. We want to know what's the difference between law, ethics, and what comprises an ethical dilemma. We want to discuss Kohlberg's theory of moral development. We have our morals are rudimental as we approach ethical dilemma. And we'll see how that plays out, because clearly that is subjective and will be specific to each nurse or each member of the healthcare team as they approach an ethical dilemma. That's the importance of ethical committees that come together, because it's a rich soil of a lot of different perspectives from a lot of different disciplines within the healthcare team. So that is a neat component to help guide ethical dilemmas. Define the following ethical theories: virtue ethics, deontology, and then theology I have written on here. I want to focus on specifically on utilitarian view. That's the one that we're going to focus on specifically for that. We're going to define ethical principles. We need to first identify the principles in order for us to know the guide that is going to drive us and to drive ethical decision making. What principles are going to help keep us in our lane, to remain professional and in the best interest of our patient as we advocate for the patient and the patient's family's wishes. Discuss the ANA Code of Ethics for Nurses. Again, if you go to the ANA website, look that up, find out where that is. You can, again, purchase a little pamphlet if you want a hard copy of that. Otherwise, just know where it is, a few clicks, and you'll have that pulled up. Explore professional roles and boundaries, and then apply moral and ethical theories and principles to case studies. So again, the application is key as we move forward. So morality and ethics, what's the difference, the differentiating factors between morality and ethics? Morality is what people believe to be right and good conduct. So me personally, morality, what I feel is right and wrong may be different than what you feel is right and wrong, and that is morality. It's learned from generation to generation a lot of times. It's the soil in which you were planted. You will bear fruit generally, not always. Some people go completely contrary to the way they were raised, but a lot of times morality will be something of the way you were raised. It unfolds. It's something that you foster, and it's very specific to you. Again, transmitted through families, through religion, cultures, is morality. The basis for ethics, on the other hand, is a set of concepts or principles that guide in determining behavior or choices. So this is a set list of guided principles. So this is more specific, and it's a framework. It's a more structured than that of morality. It's a structured, identified framework that allows us to analyze and make decisions or choices when we're faced with an ethical dilemma. What is the right and wrong? What is good? What is bad? And what is going to ultimately support optimal outcomes for that patient? What would be in the best interest? And knowing that you may be faced with a challenge, that there does not seem like there's any positive option, but we need to choose. Given what we have, we're going to get into that rub, and we still need to be able to identify, peel that back, conversations with the patient, with the family, looking at all the pros and cons of all the options, and then making an informed decision, or giving that information so the patient can make an informed decision, and then we as the healthcare provider, we as the nurse, will help implement that. In a case where the patient's wishes are very vastly different than yours, there can be an ethical rub there as well. It may be very difficult for you to practice in an environment where you are constantly faced with ethical rubs. And in that instance, I would probably recommend maybe coming in and let's talking about other options. There may be a place that may be a better fit for you. Or maybe there's things that we need to work through that's triggering that. But just being self-aware of, is there a part of you or through self-reflection? Is there an aspect that maybe I personally need to work through or get counseling with or help with because something is a trigger for me? Wanting to make sure, again, we keep personal and professional boundaries. Kohlberg's theory, theory to moral development. It's based on Piaget's work on his model, interviews with boys regarding a series of ethical dilemmas. Logic and moral reasoning develop naturally through ages and developmental stages. So, according to Kohlberg, this is going to naturally unfold through as they develop and through as they chronologically get older, and then developmental stages as they mature. Stages are separate and qualitatively different. Each stage is considered to be more complex than the previous one, so obviously we have to conquer the first step before we can climb to the second, before we can climb to the third. We don't just jump to the fifth. So it's a natural progression. You can see the stages. I have listed these slides here, but this is, you can remember, you're probably going to remember this from developmental psych or possibly from lifespans if you took that course with me. Level 1, 2, and 3. This again, to remind you, is pre-conventional. Individuals concerned with self-interest and external rewards and punishments, that's pre-conventional. Conventional, which is level 2, that is individual does what is expected of him or her. And then level 3 is post-conventional. Individuals is developing more autonomous decision making based on principles of rights and justice rather than just purely off of the consequence. So they're going to look at the big picture. Obviously, hopefully, as we went through there, level 1, level 2, and then level 3, or more self-aware of the world around you and the decisions that you make and how they impact the world around you in the bigger picture. So that's the progression. We're speaking of pre-conventional again. This is going to be your child typically up until around 8 or 9. Some adolescents, and even we look at, as there's a deep dive taken into criminal offenses, sometimes can still be falling into the pre-conventional stage, not looking at the consequences or the repercussions clearly. Morality is by direct consequences. So if there's not an immediate consequence, that's what determines the pre-conventional. Then stage 1 is based on reward or punishment. Stage 2, learning to share, adherence to rules, fairness, which is individualism and exchange. You don't need to go too deep into these, just be aware of the natural progression. Conventional more typically is tied to guilt, and that's adolescent or typically adults will stay in this stage. But that is going to be conventional, which is the second one. But living up to what is expected by other people, this is going to be more of peer pressure is going to be involved when it comes to adolescence. And then maintaining social order is also unconventional. So you're thinking young adult, more as an adult. You want to maintain social order by following laws, knowing the repercussions of those, the cause and effect of living harmoniously in society. And then post-conventional, less than 2% of adults. This is not something that's naturally obtained by an adult. So this is going to be a key slide here that you realize. There are not many, less than 2% actually attain this. And social contract, individual rights, and then principled reasoning. Typically, the end must justify the means. And just know there are 3, is specifically to Kohlberg's, just know there are 3, pre-conventional, conventional, and post-conventional. Know where generally a child falls versus adolescence into young adult. And most adulthood's going to stay again in the conventional stage. And then there are very few that go to the point of principled reasoning, realizing I'll sacrifice myself if I know it's for the greater good, that see the big picture and read on that, and you'll see specifics that you can see. But key to post-conventional is no, less than 2% of adults even actually reach this, according to Kohlberg's. Again, remember, this is a perspective from a theorist, and he believes that for the most part, adults and adolescents remain at different stages within, but still remain in the conventional stage. Heinz dilemma. Sit back, relax here for a minute, and I want to give you a scenario, and then I want you to think about it. This is not healthcare related, but it is an ethical dilemma. So we have a man. His name is Heinz, and Mr. Heinz, his wife is dying. The druggist in town has discovered a cure, and it's going to cost him $200. But the offer is to Heinz for $2,000. So the pharmacist can make it for $200, but he's offering it to Heinz for $2,000 because he has a cure that Heinz needs for his wife. Heinz asks everyone he knows, and he's trying to come up with the money, but he can't. He comes up with about $1,000, but he needs $2,000 for the cure. He promises to pay the rest later. What does the druggist say? He says no. The pharmacist says absolutely not. $2,000 or you don't have a cure for your wife. He wants to make adequate money, wants to get rich off of he, after all, has created the cure, so he wants to be compensated very handsomely for his finding. That night, Heinz decides to break into the pharmacy and take the medicine for his wife, for the betterment of his wife. He did all he could, he feels, to raise the money. He gets the money that he has, that he was able to get from family and friends and working and savings, everything he has. He can only come up with $1,000. He gives that, but he does not have the $2,000 needed for the cure. What are your thoughts on that? Is that okay? Does the end justify the means? It was worth it to him because he got a hold of the cure for his wife. Could he realistically live with himself if he knew there was a cure and he did not obtain that for his wife? Look through both lenses. Is it ethically right to gouge people? We see this a lot with different things, whether it's gas, whether it's food, whether it's a medical procedure that someone needs. When we know there's a need and it's in scarcity, and it can actually be a gouging to someone that critically needs it. In this case, it's life or death. So let yourself think on this and think, what would you do? What would you support? Do you support Heinz? Do you support the pharmacists? What are your thoughts in this specific healthcare dilemma? And values, ideas or concepts that give meaning to an individual's life. They may be stable, and they may not be. They may transition as you get older. If you were raised in a home where honesty and hard work, let's say, were paramount, that you were honest and that you were hardworking, generally speaking, if you were raised to be a hard worker as a child, you will be a hardworking adult. That's the perspective generally that us as parents have. If you instill that, then that will carry through, and you will raise a responsible young adult that transitions into adulthood of contributing to society. However, sometimes they sway. Sometimes different environments that we are in for certain stages or periods of our lives can sway those values. But whatever values that you have and you hold dearly, that is going to help the lenses or guide the lenses through which you see life in your from your personal perspective. Now, those will also help guide you in your professional role. So if my values are that I am a hard worker, I'm going to be a hard worker in my professional role as well. Some of these carry over. If things there are some that you may have that then when you get into a professional role or a culture on a unit that you work, maybe those values aren't upheld, and that's going to be a real rub. If I am a hard worker and I cannot sit still knowing that there's a patient that needs something, but I'm on the night shift and there are 5 other nurses and techs, assisted personnel, and they're all sitting in the break room talking and watching an episode of The Bachelor, and I know the call light is going, that's going to be a real ethical rub for me if I feel I'm floating the work of the entire unit while that value is not upheld by my coworkers. Just a trivial example, but still showing how values can actually impact in real life as you embark in your profession as nursing. Also, I hear this from students, certain things. When I would have students in them post-conference, they'd say, this really bothered me. This really bothered me, and I can't shake it. I can't quit thinking about it. I'm like, let's peel that back and tell me why. And more times than not, it boils down to a value that they hold dearly that is being infringed upon or not being upheld, especially when it would help to strengthen and maximize optimal outcomes for a patient. They feel that patient was wronged or not advocated for because of a certain value was overlooked. And that is another application process that I want you to think about as you are a nursing student. When you are in the clinical setting or wherever it is, it can be just in society in general, within your cohort. If things rub you, identify that. When we're in class, I also like to take a pause and just write down, I'll put them up on the board, write down 3 values that you hold dearly, that you want to make sure 5 years down the road, 10 years down the road, you don't start to get lackadaisical on those, but that you want to be the kind, that's how you want to be defined as a person, and that's how you want to be defined as a nurse. Putting action to that and putting those actually on paper, typing those somewhere, putting them on your phone, reminding yourself and holding yourself accountable is so critical. So ethical theories, again, the one I want you to hone in on is utilitarianism. Overall consequences are what matters. It doesn't matter how we need to get there as long as we're focused on what's best for the greater good. So this is where the ethical dilemma of stem cell research and embryonic research, it doesn't matter that there's an ethical dilemma evolving around when life begins and when it naturally ends. That's okay. Push that aside because we're focused on if there's potentially a cure here, we can justify that if down the road there are lives that are saved. That's the utilitarianism perspective. Or we want to make sure with COVID, when it was masks, vaccine, there were several things that were being mandated and things at this level impacting individuals, but with the mindset that maybe if we impact and mandate things here, there will be greater good for society as a whole. Deontology is basically off of rules and principles. This is the 5-step process of how this goes. It doesn't matter what my values say, if this sits well with me. It doesn't matter if it's necessarily right or wrong for the patient. It's a set of rules, a set of norms, a set of policies and procedures is based more for deontology. And then the virtue ethics, as I've mentioned, just kind of jumped into this one early, the character virtues that make you who you are and blossom into the professional that you will become. Again, just another recap on utilitarianism: greatest good, benefiting the greatest number of people, ends will justify the means. They can change on depending on the situation. It's not set in stone, so you can also feel for this must be very subjective depending on who's driving the bus of this on the track here. Nothing is inherently right or wrong. No right or wrong, very subjective. So maybe elected officials will steer this, whoever happens to be in the director's chair might steer this, whoever is in charge of research, whichever arena. If there's not really right and wrong, end justifies the means, then it is very subjective of, it can be politically driven, religiously driven. Healthcare has their say, lot of different perspectives. So there can be a lot of controversy surrounding utilitarian views. Deontology, again, right or wrong, this is set, and it's not based on necessarily, we'll change our plan here based on what the results or the consequences might be. It's not. It's set in stone. It's absolute and universal construct. Duties and unchanging rules. Obviously, if it's policies and procedures, there can be some tweaking, but you're going to go by the book with deontology. Principalism, again, ethic flows. This perspective is my ethics flow from my moral norms, who I am as a person. That's how I will function and approach my professional career. Principle valued by society that often underlie ethical dilemmas. Society has a lot of controversy related to these. So again, it's based on me when we're speaking specifically a nursing student to an emerging nurse. Have self-awareness and self-reflection to know what virtues that you hold dearly that you can bring through. And in healthcare, it's the underlying principle generally is, that's why we're the most trusted profession, because generally healthcare professionals want to do good. They want to be honest. But what do I do when I just found out the test results and realize that we have run out of options, and now they got another positive result, and knowing what that's going to mean, and when a patient asks me, am I going to be okay? But I have an ethical principle and a virtue I hold dearly, which is honesty. So what do I do in that moment? These are the things that we want to think about ahead of time so that we're ready when they unfold. We're not caught off guard. Principles are considered moral absolutes. Principles are prioritized. I will prioritize if I'm hardworking and I'm honest. These are things that will be, if I'm just, I want to make sure there's justice for all. I'm going to give the same care to a patient with no family that that healthcare team is viewing as non-compliant, in that they in some way deserve what they're here for, versus another patient where it's a young child and the family is there and everyone's rooting for them, balloons and signs and everything in the room. I'm going to give the same care to both these patients because I believe in fairness and justice for all. Another virtue. Again, go through a list of virtues and find ones that identify and resonate with your soul and who you are as a person. And then once you have that self-reflection moment, you'll be able to unfold and let that blossom into your professional nursing career. Beneficence. Beneficence is doing good. We hit this in the legal lecture as well, but again, no more than just the definition of doing good. Know how to identify that. I gave examples already, but prevent or remove harm. Find things that will make it better. If you can find things that will make it better, it may be extra time involved. It may be going the extra mile. But in beneficence, when you're looking through those lenses and that ethical principle is being applied, you will go the extra mile. Easing pain, saving lives, encourage people to be the best that they can through health promotion. All things, going out and realizing that we have a real issue of things related to teenage pregnancy or related to smoking when adolescents seem to be with drug use, these things. Going in and supporting health promotion. Do good, invest in health promotion would be another example. Non-maleficence, do not harm. Key here, so again, we're removing harm. Obviously, do not touch or harm your patient physically. We can harm them in other ways by knowing not providing adequate pain relief. Even though it's a PRN, we know they're going down to physical therapy. Be self-aware enough, be advocating for your patient enough to prioritize 30 minutes ahead to make sure that you offer an adequate pain regimen, and you let them know what their options are and see if they want that. That would be helping to avoid harm for them when they go, knowing they'll come back in pain. Concept of double effect. Double effect will be a case such as someone in hospice. If you have a patient in hospice and you want to know, I have an order to give a pain medication that is nearly twice what's the safe recommended dose. That could potentially harm the patient. However, you're looking at both and realizing in this moment and in this time, their comfort measures are critical and paramount in knowing that this is not ideal, and in most cases this would be a bad choice. But in this case, we're going to weigh it out, and for that patient to be comfortable and have that adequate palliative care, then this would be justified. That would be the case of a double effect. Autonomy, personal freedom. This is in the case of informed consent would be an example. Self-determination, self-governance. That patient has a right to choose regardless of whether you agree with it or not, and you need to get to know that patient. You need to apply Gene Watson's human caring connective theory and get to know that patient so that you can adequately advocate for him or her. Examples again, informed consent, right to refuse treatment. A patient must have the consequences and pros and cons of both. And what are options if I don't agree to this procedure as well? But finding that out, if the patient's not able to make those decisions and communicate that effectively with the nurse, then you need to go a step further and find out from family caregivers that might be in the room, trying to identify a plan of care that is in the best interest, because knowing whether you agree or not, we're not there to coerce or persuade. We are there to be advocates for that patient and the desires they have related to their health care. Veracity, tell the truth. Examples are answering patient questions in fact statement. Okay, you do not give your personal opinions. It is okay to say the doctor will be in with the results. You do not have to give the results yourself. In most cases, that is not your role anyway. So staying functioning within that proper role in your proper place, in your proper scope of practice, would just be to revert that to the patient will be, or the doctor will be in, the provider will be in to go over those results for you. In the meantime, is there anything I can get for you? How's your pain? Do you need anything else in here? How are you doing on your fluids? Do you have your meal tray coming up? Can I get anyone else anything in the room as they support that patient as well? Being cognitive and aware of the conversation that is going to soon unfold, but you're being that little supportive step, that bridge in the process where you can still tell the truth. You would not want to say that you don't know, or you do not want to be the one to give the test results when that needs to come from the specific provider. If someone says, am I going to die? You would say, especially if it's a child, you want to involve the caregivers on those conversations, but you want to say, you know what, I'm here today, and we're going to make this the best day you have had. How can we make this a great day? And you kind of revert back to the things you can control. And you can control maybe now, what we do now, what we do this afternoon, if we want to get up and go for a ride around the unit. Or can I go get your favorite game and bring it in? And then someone sits and plays that with the child, reverting, but making sure if I tell a patient, especially a child, that when they have a procedure that they're they're going to get an NG tube and they're terrified about it. And they ask, will you be with me in the treatment room when I get it done? And I say, yes, I will. If I get busy and I'm with a discharge and someone else is going to do the procedure, I need to let that patient know why I'm not in the room, or I need to delegate something else so that I can be in, because if we're going to remain the most trusted profession, we have to keep our word, and veracity is very important. That honesty, when you tell a patient you'll be back at a certain time, you better be back at a certain time, or you need to make sure that you call into the patient's room. Hey buddy, I'm held up in another room, but I know I told you I would be back. I'm coming. I'm going to send somebody in the meantime with that popsicle that I promised you. Follow through and close the loop. Fidelity, faithfulness, loyal, keeping promises. Again, this is piggybacking off of veracity. Justice, equal, fairness for all. Mentioned that one already. Best interest, what is good or what is right. Paternalism. Here we go again with the virtue ethics. As I mentioned, this would be the exercise that we would do. Bottom line, know what makes you you, know what things, identify at least 3 is good because you can manage that. Know how, again, you want to be defined at 5 and 10 years as a nurse. You want to stay sharp with those and have that solid, virtuous foundation as you're knowing your morals are going to help drive you to be a strong professional. ANA Code of Ethics. Statement of ethical obligations and duties. This is non-negotiable. You don't pick and choose the ones you want to abide by. The Nursing Code of Ethics are the guidelines and the lenses through which you must practice as a professional registered nurse. I have those, the provisions here. There are 9 of those. I encourage you to go through. There's also a sheet of case study examples. You can see time's kind of getting away from us, so I'm not going to dive into each one of these, but take the provisions. The nurse practices with compassion and respect, inherent dignity, worth, and unique attributes for each person. All of these are going to make sense to you, generally. There's even one on there of taking care of yourself so that you can better take care of your patients. These are going to make sense, and to me, they're feel-goods. They're the soft art and caring of nursing that is rudimental in delivering quality care and promoting optimal outcomes for our patients. However, when we get busy, will we still be able to apply? Will we still be able to apply these provisions, these 9 provisions of Code of Ethics? Very important. When we start to get lax, when we don't want to get in a rut and get soft on these skills. We need to stay sharp with reference to the Code of Ethics. Advocacy, again, advocating for that autonomy and self-determination of that patient. Difference between ethics and law. Ethics is concerned with the values and beliefs of individuals, whereas law is rules and regulations, more of a society, the difference. Ethics is concerned with motive and attitudes. Ethics wants to know why. Why did the person do what he or she did? Why did that unfold the way that it did? Ethics wants to know why. Whereas law is just more concerned of the conduct or the action. What happened? What did the person do? We don't need to know why. If this happened, this is the consequence, would be the law. Ethics is enforced by committees and professional organizations. Again, I mentioned having an ethical committee within a hospital. They don't tell the nurse or the patient what to do. They help guide and offer support and suggestions and help look from different perspectives. Let's hear from the pharmacist. Let's hear from the provider, from the nurse. For me, it can be a tech, it could be whoever. Let's bring the chaplain in. Let's get a rich environment and then help offer guidelines and suggestions, but they will not tell a patient. They will not dictate, because again, we support the autonomy and self-determination of that patient. And then law enforced by courts and statutes. So it is actually enforced. What was done, what was the result, and here's the consequence. No flexibility. Ethical cases, there is a slide for that. and you have this on Harvey in a module. Look at these cases. There are 6 of them. I encourage you to read through all of them and jot down at least 2 emerging principles, ethical principles that you see emerge out of each of those patient scenarios and those case studies, because if that's the key, is the application. If you want to go over those or you have questions, most of them are going to be pretty apparent, pretty obvious. If you want to go over those though, feel free to make an appointment with me. Stop by. I would love to take a deep dive in this. I truly am passionate about ethics in infiltrating that through our profession and staying sharp with that. So I would love to talk to you about that. And I think that is all. You've got your review at the end. Again, look at your blueprint, look at your study guide, look at your case studies. And if you have any questions whatsoever, I'm more than happy to connect and help you. Otherwise, good luck with the material with legal and ethics. Take care, guys.